Imagine a patient is sitting in their home, scared, confused, and not understanding what is going on with them. They become frustrated. Why are people coming to their house and making them do tasks every day without explanation? Why do they have to take medications day in and day out? What is the purpose of the medication? What is it doing? What is the purpose of doing the repetitive exercises? Why is this patient left in the dark about their treatment? How do patients understand the unknown? Patients look to healthcare professionals to help them. At times, patients do not understand the diagnosis and will look to someone to help better explain it to them. Education is a basic human need. Education is a key to patient care. It is an important process in which a healthcare professional passes on information to patients and their caregivers. By giving this information, this will not only improve the patient's health status, but will hopefully encourage patient involvement in decision making related to ongoing care and treatment. Unfortunately, the healthcare system is faced with the problem of patients that are not always getting the education that is required. In a recent study, it was shown lower health literacy can be related to negative health outcomes, and unfortunately, this issue occurs with many patients. It has been estimated that approximately 80 million adults in the United States have limited or low health literacy. This becomes a problem when patients are getting treatment and they are not understanding why or what the treatment is for. So, why is patient education important? Health literacy is an important concept when educating a patient on their illness and what they will need to continue to help improve their quality of life or care. If the patient has a poor understanding of their treatment, they are less likely to follow suit and stay on track with their treatment. It is important that a patient is receiving a proper diagnosis of a disease, illness, or disorder before the patient is started on a treatment plan. But there is also evidence that getting the right education for a treatment is important. If a patient misunderstands a condition and the treatment, it can result in a noncompliance to a doctor's recommendation, significantly and adversely affecting outcomes. The more the patient can understand their treatment, the more likely the patient will be comfortable with their care and adhere to needed treatments. When a healthcare professional is educating a patient, it needs to be taken into consideration the patient as a whole. What is that patient's health care literacy? How does that patient best learn? How can the healthcare professional help that patient better understand? What does that patient not understand? And why is this important information to the patient? And how can the healthcare professional reach out to that patient and help them better understand? How can we make the change? At Northeast Michigan Community Mental Health, the patient is the main focus. The mission statement is, it's our mission to provide comprehensive services and supports that enable people to live and work independently. Education has been proven to be vital in a patient's care. How the patient perceives it and understands it can make a difference in the overall health of the patient. If the patient does not understand the disease process or disorder, there is a chance the patient will not stay on that prescribed medication or continue doing the exercises that need to be done, or the patient may not push themselves as hard as they are capable of being pushed. Lack of understanding needs to be changed in the care of or treatment of a patient. Patients are coming to healthcare professionals for answers and understanding. There's more than one way to approach education with the patient, and utilizing more than one solution for education could play a role in the patient having a better understanding of the material. Healthcare providers need to understand the importance of education, and the patients need to understand why this treatment is important and what it can do for the patient to have a better health outcome. By ensuring the patients are understanding their treatment, this would allow them to do more independent and continue to live independently. Now this brings us to the plan. Healthcare professionals need to first assess the patient's health literacy. What does the patient understand? Is the healthcare professional breaking this down enough into layman's terms? Healthcare providers need to understand the level of education for the patient. The patient may not be comprehending what is being taught to them. Healthcare professionals need to question the individual's understanding of care and move on to the next lesson. After literacy has been assessed, the next step is how is this patient learning most effectively? There are many ways patients are capable of learning. Healthcare professionals need to be flexible in learning the different techniques of how the individual learns. Does the patient learn visually, hands-on, reading, or even verbally? How are the healthcare professionals going to engage the patient in learning? This does not need to be one person's responsibility. This would be a team effort in implementing all of the care. At Northeast Michigan Community Mental Health, for example, there is a team of individuals who are providing care for the patients. Looking throughout the members of the team, the person who is coordinating the patient's care and monitoring and creating the care plan is the case manager or the supports coordinator. A case manager is working closely with the individual, assessing the patient, ensuring the goals that have been implemented into the care are being addressed. The case manager can also provide education to the patient if the individual does not understand or has confusion. The case manager also works closely with the physicians and asking why medications are being prescribed and what the physician believes would create a better outcome for the individual. The case manager will then implement that information into the individual's care plan. After the care plan has been created, the case manager will then relay the information to the workers that are working with individuals. It is important for the workers to understand the treatment for the patient. When there's a better understanding, it will be more effective in the teaching of why. At Northeast Community Mental Health, there are many different types of programs that allow individuals to work with the patients. There is a SIP program, or the Supported Independence Program, and the CLS program, or the Community Living Program. Both programs have workers who will work with individuals on more than a daily basis. It is very important that these individuals are understanding the patient's treatment plan and educating the patients on their goals and interventions. The case managers also work closely with these individuals in communicating the care plans and objectives. Education needs to be addressed throughout the care plans. The case manager should be able to incorporate education in the care plans so it can be set as measurable. By creating the goals to be measurable, this will allow you to be more accurately to assess the information and it is more easily understood. Case managers meet with the patients quarterly and annually throughout the year. This would allow the education to be assessed and monitored. Monitoring the patient has an understanding. The team needs to work together and communicate what is working with the patient. Is the patient improving and understanding what needs to be changed or addressed? Now you may be sitting there wondering, how can this be done? How long will this take? We need to be patient and we need to look at our patients as a whole and evaluate the patient. How are they understanding? What are they not understanding? What do we need to change and help them understand or be educated more? And incorporating that into our care plans. We need to make improvements in our care plans and making sure for the better of our patients that they are getting more education and understanding. Why are they taking this? Why are they doing this? What is the reasoning behind it? We need to communicate with our workers and everyone else that is working with the patients to ensuring that it is incorporated, and we need to be assessing the patients. Is this working? Are we getting someplace with this? Is this not working? Assessing, reassessing, making sure and seeing a difference for our patient, because we are patient-centered and this is patient-centered education. We need to make this happen. This change could happen to ensure patients are getting education and understanding their treatment. It is a huge struggle to speak with patients that do not understand why they are doing something or what a medication is for. As healthcare professional, it needs to be addressed and added into the individual's care plans to ensure the patients are receiving the adequate care and what they need. This will not happen overnight, but this will reflect the patient's care. Healthcare professionals need to be patient and listen to the patient and work with others throughout the team to incorporate effective communication and what we can do to ensure adequate care for the patients within the community. This could be an effective change and could be done over time with just a few minor changes throughout their care plans and their communications.